Hi everyone, Katie Hart,
Reese Gorski.
and today for our project we're going to be doing collaborative therapy. Our client is a 33-year-old adult female who presents today for therapy after urging from her coworkers. She works as an exotic dancer and bartender, and 3 weeks ago her fiance left her. He was diagnosed with terminal cancer, and he decided that it would be too hard for her to watch, so he left in the night. So since then, she's been spiraling down into depression.
She has a history of depression. She left her family around the age of 16. She doesn't reveal this in exam, but it was due to a history of sexual abuse. She got involved with drugs and also would self-harm frequently. Since finding her fiance Wade about 3 years ago, she's done a lot better. No episodes of depression, no drug use, no self-harm. But now that he's gone, she's going back down that negative path.
So today will be it'll be the first therapy session. Social joining and use of collaborative therapy. All right. Hi, Vanessa. I'm Katie.
Hey, Katie.
So, tell me what brings you in and what's going on. Tell me about yourself.
Well, I guess there's not much to tell. I'm a bartender part-time and also do some exotic dancing.
Okay.
I recently lost my fiance. He was only my fiance for a short period of time, but we've been together for 3 years. Mm-hmm. He left after finding out he had cancer. He didn't want me to see him go through that because he didn't have any hope that we could help him. So he just left.
That sounds like a terribly hard situation. How have you been doing?
I mean, it's killing me. I can't. I don't know where to go from here.
And when you say it's killing you, do you mean emotionally?
No, I don't think you understand. I'm dying inside. I can't function. I can't breathe. I can't do anything. It's killing me.
I'm sorry you got that wrong. I hope anytime I get something wrong, please, you're the one who knows your situation best. You're the one who's lived it. So if I ever get it wrong, please correct me. So thank you. I don't, you know best in this situation, and I'm here just to help you.
Okay.
So tell me, have you ever been through anything like this in your past? Tell me a little bit about your past.
Well, I've never had anyone leave me, but I left my family around the age of 16 and was pretty depressed for a really long time and did some things I'm not proud of and did a lot of drugs and hurt myself quite a bit. Did a lot of cutting.
Okay. Have you been thinking about cutting, the history? Have you been thinking about cutting or killing yourself?
Well, not killing myself. I've never thought of killing myself, but I have thought of cutting because it helped. It helped take the pain away.
Okay.
And so did doing drugs. It made me numb, and so I didn't have to feel what was going on. But I guess it never helped anything.
Okay. So it sounds like, they were the outlets you used to feel better, but maybe it took you down the wrong kind of path, not where you wanted. In the end, it might have hurt more.
Right. Yeah.
Okay. So is there anything that you tried that did help? Is there anything that has helped in the past?
Well, the cutting and the drugs helped.
Mm-hmm.
Just not ultimately. I did used to do some art too. I feel like things have been destroyed in me, so I wanted to create things, and then it helped me just kind of let go of some of the stuff that happened.
What kind of stuff did it help you let go of?
I don't want to talk about that. I just, yeah, I don't want to talk about that with anyone. But if we just focus on, I just want to focus on this.
Okay. You know, just like I told you earlier, I respect your opinion. You are the one navigating this. I'm just here to help you. And I am so glad you're here. You know, I'm here to help you, and we'll move towards feeling better. And, you know, if you don't want to talk about something, that is your right, and I'm not going to push you to do that.
Okay.
Okay. So getting back to the art, have you tried that recently?
You know, since I was with Wade, I really just stopped doing those things. I stopped doing a lot of stuff that were just, I guess, just for me, you know, because we were a couple, and I felt like that was the most important thing. So I haven't done any of my art in, you know, almost 3 years.
You know, this is a terrible situation, but all we can do is see the best in what's here. And it sounds like this might be a nice opportunity for you to get back to things that you used to enjoy, things that you used to be good at, things you got joy out of.
Yeah, that feels like so much work. I just don't feel like doing anything. I don't know how I could even like anything else.
And I understand that you've been through a great deal of trauma in the past few weeks, and it's normal to feel like, especially if, you know, sounds like some depression going on, that you don't want to do things like you used to. And I don't, you know, expect you to go out and paint a big mural, but maybe getting your paints or whatever you use out and, you know, attempting to work on something.
I guess I could get them out. I could do that.
Okay. You could work on, you know, like I said, it's little by little steps to getting to feel better. That's what I'm here for, and we're here to work together to get you feeling back to where you were before.
I can't even imagine that. I just feel awful all day long, every day. It's just, there's never a good in my day anymore.
So there's no good at all?
No.
Okay. If there's no good, do you think that maybe there's even a time in the day where you don't feel as crappy, that things aren't as bad, maybe a little portion of any time of the day?
When I work and it's busy, things don't feel so bad.
Okay. So it sounds like maybe, especially if you're saying when you're working and it's busier, that you might be distracted. And again, this might be a good way for you to use art to distract you from when you're feeling really low or thinking about hurting yourself even.
Right, that makes sense.
Does that make sense? Okay. So, you know, you talked about not wanting to focus on the past, and that's big. You know, you don't want to talk about that, and that's great. You don't have to. What some people find helpful sometimes is to write letters, either from point of view from someone else or from their own point of view as a therapy tool. What I was thinking, and you can tell me what you think about this, is where do you want to see yourself? Do you know, where you might want to see yourself going? How you view your life?
I don't know. For so long, I've thought that my life view was with Wade, and he's gone. And I don't want to be like this.
Mm-hmm.
But I don't know what would be the person I want to be without him.
And I don't expect you, we don't have to do that today. I'm thinking towards the future. Our next session we start working on, and again, this is up to you, starting to think about how do you see your life? I wouldn't think of it as without Wade, but how do you see your life on your own, and, how you see things going, and you might write yourself a letter as the person that you want to be.
can talk about that.
Okay.
Maybe do that.
Okay. And that's, we're working towards getting you better, and together we will do this. And again, it doesn't have to be next session, but I want you to start thinking about it. I think it would be helpful. It was wonderful meeting you today, and I hope, this will be us working together to get you back to feeling stronger and, feeling better about yourself.
Do you think that's possible?
I think that we can work on it for sure. Okay.
Thank you.
No problem. Okay. All right. So during our therapy session, during the joining phase, we used a couple techniques.
Honoring the client's wishes. Vanessa did not want to talk about her past clearly in the session, and Katie several times reinforced that she was going to honor that wish and let Vanessa navigate the sessions the way she felt like she was comfortable with.
And the other one, when she was saying, I don't want to talk about, it's part of this, but I don't want to talk about the past. Well, I said, you're the expert, you're the one who is going to tell me only you've lived like this, and if you don't think that's helpful, then that's fine.
So in collaborative therapy, it's not the therapist who considers themselves as the expert in the other person. It's respecting that the client is the one with the expertise. Some of the basic therapy skills that we used, there was reframing when Katie brought up that even though there was the loss of Wade, now there was time for Vanessa to pursue art, which she previously used as not only a coping skill but as something to create, and she enjoyed earlier on in her life.
And also about the art, she said, I just don't feel like doing that. Art sounds like a chore, and making Vanessa understand that it's normal to feel like this. You just went through a lot. You're not abnormal for having these feelings. That's typical.
And providing hope. That's an important piece to all therapies. And when Vanessa was feeling that things couldn't get better, or that there was no time that was any better than others, and Katie, throughout the whole session, found little pieces of hope and then brought it in at the end that they were going to work through this issue together. Also, crisis intervention. So when Vanessa was talking about things killing her and past history of self-harm, Katie immediately went into crisis intervention mode and assessed for suicidality.
And specific to collaborative therapy, the two techniques we chose, one was the use of the pause. Vanessa, when we talked about the letters to self, which is another technique we use, she took a pause to listen to her inner voices and think about how she really felt about that, listen to herself before answering.
And then the letters to the voices is a collaborative therapy technique. It can come from different perspectives and different points in the patient's life. However, Vanessa was so reluctant to talk about her past. Katie chose the letter from who she wants to be, and that could be a springboard for interventions or coming up with the way to work with her in therapy.
And focus on goals and that's coming right from her, and that goes back to her as the client being the expert. So she outlines those goals.
And then the appropriately unusual questioning or comments. Katie talked about how these things were not, these things didn't work for you in the past. Have you considered how we can make things work for the future? How are we going to change this for the future? So it was within the client's scope of understanding and possibilities.
Thanks, everyone.
Thank you for watching. Oh, yay.